So most people that are working through a POTS or a dysautonomia diagnosis have heard of the Levine protocol, or if you haven't heard of that, you've probably heard of the CHOP protocol or the modified CHOP protocol. It's an exercise prescription that's used to help people with deconditioning, and it's been applied to people with POTS as well, and it's actually quite commonly prescribed. I think the one thing that we can benefit from understanding is, obviously, if people have been dealing with POTS for a long time, especially if they've not been able to get out of bed, they become deconditioned. But the question is, are we treating people for deconditioning, or are we treating POTS itself? And I would argue that a lot of times the mechanism of what people are experiencing with tachycardia, especially if it's a compensatory tachycardia, may actually not be responsive to exercise. So it's really important to be able to determine if it's the right fit. The original Levine protocol was built out of helping astronauts regain capacity after coming back from a space flight. So space flight, you're without gravity, you're outside of our ionosphere. It changes the stimulus on our body, which causes symptoms that look like deconditioning or look like POTS. But when you return them back to the earth and put them back in a normal environment, simple things like just getting them exercising and moving again work because they're previously healthy people. If we flip that around though, if we look at POTS, or if we look at these myriad forms of dysautonomia, we're not taking someone that has just been removed from a normal context and then we just put them back in it and they do better. The actual physiology of the way that their body is trying to adapt to simple things like gravity, sending blood flow around, getting your heart to beat right, getting your blood vessels to constrict right. Those are actually physiological errors. So it's not as though we just need to change the context. We actually have to change the physiology to better adapt to the world around it. So with that basically said, is we want to think about mechanisms. We want to think about what is actually failing, and does the prescription that we're using, whether it's physical rehab or neuro rehab, does that fit with what the problem actually is? If it is something that can benefit from cardiovascular fitness, from increasing circulation and oxygenation to tissue, that's awesome, and it's a super good tool. But a lot of times what we find is we work through the mechanism or the failure that's causing that response in the first place, and then we stack on top of it the exercise demands to be able to regain function again, to be able to get them out of that deconditioned state.